fun for us here, because I think this headline, "Committed to Protecting and Promoting Health and Welfare in Finland," sounds so big, but that's what we are. National Institute for Health and Welfare. The abbreviation is from Finnish and it's THL. And we are an expert agency carrying out research and development. And it's for health and welfare services in Finland. And it should also help decision making of the politics in this country. We are working on the Ministry of Social Welfare and Health, and ever more and more we are supporting the ministry. THL is quite new. It was established in 2009 through the merging of the National Public Health Institute and the National Research and Development Center for Welfare and Health, STACES, as some of you know it much better. And to tell you something about the situation, what we are living now, I am sitting here in my little office with removal box, because the ongoing forming of DHL is still going on. People are moving in and out, in and out. I am sitting here now at my own place. So our duties are to promote health and welfare of the Finnish citizens, prevent diseases and social problems, and to develop social welfare and healthcare activities and services for the municipalities who has the main responsibility of Finnish citizens' health and welfare. We do massive research, development, monitoring and evaluation. And we have also some official tasks, and we are one of the statutory, sorry, that's a very difficult word, statistical authority in health and welfare. We, of the official tasks, we have, for example, the malformation register, and we have forensic medicine working in DHL also. We are active all across Finland. The main office, of course, is in Helsinki, but we have 6 satellites all over the Finland. The northeast is in Oulu, that is about in the middle of Finland, because Finland is a very long country. We have total staff 1,200 person years, but only 2.5 in working with assistive technology directly. So, and I am one of those. Something about our funding, just to the main point is to see that I'm trying to get the pointer. Oh, it's there, sorry. This figure, 59% of our income comes from the state budget, but this piece of the cake is diminishing all the time, so we are more and more dependent from the outside funding. I think that's enough about the funding. Something about the strategy that we are using towards future. Our vision is to have a just and sustainable society for all Finnish people. And also we have the mission. We are an effective expert agency, And once again, we are committed to protect and promote health and welfare in Finland. A small picture of our organization, and we are, where I am is the Division of Health and Social Services. Other divisions are health protection, welfare and health promotion, and welfare and health policies. And then we have also Unit for International Affairs, Department of Communication, and Information Department, and also administrative services. A little bit more about the Division of Health and Social Services, where I am working and where all the work with assistive technology is done, or most of it is done. We have the Service System Research Unit, where we form a little team of disability and society, and with this team we have our assistive technology personnel, the whole 2.5 people. This is our little team, Disability and Society team, that was founded in the beginning of this year, so we are very new. We have three main units, or what you could say: assistive technology services, disability services. This is the main. This is the something that we are putting the most of the effort, because this is something new in THL. And then we have also accessibility advancement, some two people working with these issues. And all our work aims at supporting participation of citizens with disability. Our challenges in the service delivery system unit or department is, as I can guess that in other countries too, are the same problems: to control growing costs and to meet the increased public demand for services. And one of the big issues is to ensure the supply of trained professionals, since the baby boomers are leaving us. They are going to retire. And to be efficient in steering and managing the service system, and to maintain an information system that supports information steering. That is one of our duties. Assistive technology services. Our goal with our work is to guarantee or to support equal provision of assistive technology services in Finland. As you see and you may know, Finland is a very long country, and we have people living here in the top of the Finland, although the majority of the Finnish people are here in the south. But everybody should have in equal basis their assistive technology services. And here are some current tasks that we have in AT services. We are supporting, or under the ministry we are writing, we have not started, we have the first meeting in end of May. We start to write instructions that support the provision of assistive technology services in healthcare. We have a new statute that was launched in the beginning of this year, and it has caused some questions, and people need some more detailed instructions. So that's what we are going to do right in a working group. Then this is one of our main tasks is to develop a follow-up system for assistive technology services. We don't have proper statistics. We still don't know how many assistive devices there are spread all over the Finland, because every healthcare unit keeps their own statistics, but there is no nationwide way to collect it, but we are building it. Also, this is a big issue that we are trying to develop a national assistive technology database. We still don't have it, but we are hoping to get it in the future. We work in many levels with ISO 9999 assistive products for persons with disability classification work. We work internationally. We are working with the international working group. We have also our Nordic group, which is very important for us, and then we work with it in national level to have the Finnish translation. Hopefully, Renzo, I know you are waiting for it, and the Eastin is waiting for it. The latest ISO 999 translated in Finnish, and so we can also put it in the Eastin. And then we have one of our research is NOMA. This is a Nordic project for wheelchairs and scooters and their usefulness. We are interviewing 65 patients who have received a wheelchair or a scooter, and we are doing a lot of questioning about how they are using it and how they find it and how it's working. We have many ways to put our message across, mainly in Finnish, although, sorry, but there are, and there's going to be some pages also in English, and also of course in Swedish, but it doesn't help you much, you others. But you can always have a look at the where is my arrow? Here. This is the DHL, our main web page, where you can find some information also in English. And then there's something if you are interested in disability as issues. This is a handbook for disability services, and there is information also in English. And then you can always put the thumbs up for us in Facebook. Thank you.
So thank you, Tula, for your presentation.
Thank you.
You were quite concise and straight to the point. So that's great. We are on time. So I would like to see if there is somebody who has a question for you. So I will wait some seconds and see if somebody raises his hand. Renzo, I had no doubt that you
I
would
was
have
waiting for
something.
that.
Yeah. So wait a. Okay, now you have the right to speak. Please, Renzo.
Yes, Tula. Could you tell something more about the instructions for professionals in assistive technology? You mentioned that you are writing some handbook. What kind of instructions are mainly on the method of provision, are mainly on clinical details, on what else?
As I said, we are starting the work. The first meeting will be in the end of May, but the questions that we are going to give instructions, I would imagine, are about the equal way of providing assistive devices. What could be an example? There has been a lot of discussion, for example, who whose duty is it to provide, for example, beds for disabled people who live in institutions? Is it the institution or is it the municipality that the person lives in? Or then I could imagine that there's a lot of talk about um, guide dogs, not guide dogs for blind people, but assist. I think they call it assistant dogs, the dogs that help physically disabled people, and provision of those, to whom and how and why.
Well, there are some other questions. The first one is from Hervé. So, Hervé, if you want to ask your question to Tula.
Yes, thank you, Sabrina. My question is, I see that there was a concern about, if I understand well, through these instructions, harmonization in the service delivery. I think that's what I kept in mind from the efforts THL is doing. I just had a question. Where is the competence of disability located? At which institutional level is it located in your country? Is it something national? Is it something which is managed by municipalities? That's something I would be happy to understand, to better understand the actually your work in that domain.
If I understood you right, the competence in this country about disability services, it should be in the municipalities.
Very much. So if you are working actually with these instructions in trying to have a common approach, even if that's managed at local level, am I understanding well?
Yes, you have understood me quite right, and the word harmonization that you used was exactly what I meant. Thank you.
Thank you.
Well, thank you, Hervé. There is another question from Michel Hubert. So, please, you can speak and ask your question. Michel? Michel? I think that maybe that you have some problems with your microphone. Might be. Okay, then, in the meanwhile, I just try to upload the next presentation. So for the moment, I thank Tula, and let's see if Michael Huber can speak and ask his own question. Okay, then. Okay, I can read your message, Michael. So if the microphone is not connected, you need to click on the button which is next to the microphone icon. There is an arrow. It opens a drop-down menu. to choose connect audio. No, in fact, indeed, we cannot hear you. So, well, if in the meanwhile you manage to make it work, you'll ask your question later, or maybe you can write it in the chat and we'll ask it to Tula later, in case. So, okay, you'll try to write. So, before giving the floor to Hervé, I would like to tell you that, as you can see, there is a box above the chat box, which is called Files too, and there you have the opportunity to download some dépliants and brochures that Hervé put just to let you have some more information about their own project. So it's up to you. If you want to download them, they are available there. You just need to click on the name of the file and then the button Save to my computer. I think now it's time to give the floor to Hervé from EASPD.
Thank you, Sabrina. Do you all hear me well? I think it's working. It's working well.
I can hear you, and now I'm. Yeah. Okay.
Okay.
I'm just putting off the microphone rights for participants in order not to disturb you. So from now on, you participants can interact just with the icons. Okay. Thank you.
Okay. Thank you very much. So I will start my presentation. So the idea is to say some words about my organization, EASPD, and the projects it is involved in. So starting with the organization itself. So the acronym EASPD stands for European Association of Service Providers for Persons with a Disability. So it's important to understand that it means that it's a generalist association. It's a NGO platform based in Brussels, which was created in '96, and its objective is to achieve equal opportunities for people with disabilities through effective and high quality service systems in Europe. And of course, these will be done when these services are affordable, available, and adaptable. So in Brussels, in the EU world, as we say here, we are the only NGO platform representing service providers for persons with a disability without any specific focus on one disability. So we represent around 10,000 service providers in 32 countries, and covering all types of disabilities. It is a membership-based organization, so our raison d'être, as we say in French, are our members, which are partly umbrella member organizations or single agency members. So the umbrella member organizations are themselves networks at national level of service providers for people with disabilities. And the single agency members are individual organizations which are interested in getting our services and participating to our activities. So it seems quite big to represent 10,000 service providers, but we are actually a very small office with around 10 people here in Brussels in the EU quarter. So in order to understand the way we work, I think it's important to explain that all our activities are structured around 3 pillars. The first one is information. We are membership based, as I was explaining, so we have to provide services to our members, and the service we provide mainly is information. We explain what is happening at European level, in all fields which are of interest for the disability world. So we do that through newsletters, news flashes. We organize events also which are covering a specific thematic point. Just as an example, in 2011 we had two big conferences. The first one was focusing on aging and disability. It was in Linz in June 2011, and in November we had a big conference in Brussels focusing on ICT and assistive technologies. So quite relevant for the group today. So that's what we try to do, explaining what is happening in the world, all the relevant directives, all the legislative developments at EU level, but also the policy developments, all the new programs, the strategies set up by the European Commission, which are interesting for us. So, for instance, at the end of 2010, there was the EU Disability Strategy, which is the overarching policy document which was launched by European institutions in order to explain their view and their strategic focus with regards to disability for the 10 coming years. So this is the type of information we try to summarize, to explain to our members. We try to explain how it can have an impact on their daily work. We also offer possibilities to exchange, so it's not about top-down approach only of explaining things. It's also about creating opportunities for our members to meet each other, to develop their own network, to get aware about innovative practices. And for instance, we are sharing with them information about the ETNA project. So that's what we do in the field of information. Innovation is the second pillar of our work. And this is about research and development, and it's mainly actually related to projects. So as a European platform, we try to encourage our members to participate in European projects, and we ourselves participate in such projects as ETNA, for instance. So that's part of our way to help our members to move towards more innovative services, but that's also helping us to get materials to better represent our members at the European level. And that leads me to the third pillar of work, which is about impact. So we were providing information, we try to participate in research and development, and then that feeds our work in the political field, meaning we try to influence what is happening in Brussels, as it can have a big impact on the activities of our members. So we try to make sure that European institutions in general are acting in a way which is respecting the specificity of our sector, which is respecting the international conventions we are supporting, like the UN Convention on the Rights of Persons with Disabilities. So that's a big part of our work. We are also an advocacy organization. So we produce press releases, we produce reports, position papers. We answer to consultations which are launched by European institutions when they are gathering expertise on some topics we are particularly aware of. So those are the three main pillars of work. I hope it is understandable. Don't hesitate to raise a hand if you want to stop me, ask a question, or say that I'm not understandable. I would be welcoming such information. So that's the brochure of my organization, the first page of the brochure of my organization, just to give you an idea, it's about impact, innovation, information. You can see that it's really the way we work and how we present our work. Then I want to talk a bit about the how we can feed those pillars of work. What the organization has developed in the last 15 years is, I would say, centers of expertise on certain topics which are relevant. And we have two different types of working groups. We call them permanent working groups. Those are standing committees and interest groups. The difference between them is that standing committees are a bit more formal, formally set up, and interest groups are have a more flexible way to work. So as you can see, it reflects in a way our core domains of work. So you see the standing committee on education, which is covering everything linked to inclusive education, specific topics covering the staff working in inclusive education and people who are working with children with disabilities mainly. So that's one of the working groups composed by members of our organizations, which are on a frequent basis meeting, and they develop a work plan. They can develop position papers, advocacy document. They launch research. They develop projects if they think that is appropriate. So one is education. There is also the topic of employment, which covers sheltered employment and supported employment. We also have a standing committee working on the enlargement topic, which means actually all topics which are relevant for our members, specifically based in Central, Eastern Europe, and also in the Balkan region. And last but not least, the policy impact group, which is focusing on the way to deliver the political message of our organization. So those 4 big standing committees come together with 4 interest groups. The first of them being the one focusing on ICT and person-centered technologies, so which is one of the reasons why we wanted to participate in the ETNA project, as it is a very important topic for us. There is one interest group focusing on occupational services, another one on independent living, and a last one on workforce development. So all those working groups are feeding the work of the organization. They are producing policy material and opinions. They are here to share knowledge, which help us to help our members in their work, which help us also to help the European institutions in doing the right things when it concerns services for people with disabilities. So this is the method of operation. Just to give you a feel of the debates we are involved in, of course, I would say that our biggest focus is the implementation of the UN Convention on the Rights for Persons with Disabilities. I'm sure you're all well aware of it. So that's an important topic we focus on. The implementation of the EU Disability Strategy, the social and health services of general interest, quality of services, the Disability Action Plan of the Council of Europe, public procurement, standardization, and the EU 2020 strategy. All those are very important topics in the European world, and we try to participate actively in all these debates by providing the information from our membership. The way we support our message is by being closely connected and structurally connected with the relevant institutions. So it goes through, for instance, an observer status with the Council of Europe, which has developed a disability action plan, and we are members of the committee which is in charge of following up the implementation of this action plan. We are also member of the liaison group of NGOs with the European Economic and Social Committee, member of the platform of the European Social NGOs. We also have a seat in the Disability High-Level Group, which is a body which was set up by the European Commission to bring together representatives of member states, plus the important stakeholders in the disability world. We also are in close cooperation with other NGO platforms like European Disability Forum, which is the voice not of services but of people with disabilities themselves at European level. We also have other partnership with important organizations like GPDD, the International Labour Organization, and thematic platforms as the European Blind Union, the Union of the Deaf, and Age Europe or AAATE, which is represented in the ETNA project. About our projects, because it can be of interest here, we are permanently involved in around 15 of them. That's of course because we want to support innovation, we want to be in when it comes to innovation, and we also want to support a certain vision. So the projects we're involved in are on all available funding streams, or almost, of the European Commission. We work with the Lifelong Learning Program, with the Progress Program, Citizenship, with the FP7, CIP, and others. So I will just say some words about projects we're involved in to give you an idea of the topics we are covering. So in the field of education, for instance, we set up a big networking project which is focusing on inclusive education. It's a network focusing on sharing information, bringing together all the stakeholders which are working in the field of inclusive education. It aims at sharing good practices, building up the political debate by comparing situations and gathering the points of view of the different stakeholders. It's a very nice project which will be finished this year in September with a final conference in Budapest. That in the field of education. Another one in the field of employment, for instance, is IBB2. IBB2 is the follow-up of another project. So the first project had developed a training model to train people with disabilities to become disability care workers themselves. So the first project developed the training, the curriculum, and now there is a project, a follow-up project in order to implement that training. So at the moment, in the countries involved in the project, there are people with disabilities who are trained to become care workers in their organizations, and also to become then leading examples for other service users, to encourage them to get integrated in the labor market and to actively participate in the work of the organization. So that's about employment. About ICT and AT, I want to mention the Inclusion project. Inclusion is about the development of a satellite navigation device for people with motor impairments. So the project was just finished 1 month ago, and the result is a prototype satellite navigation device working with Galileo technologies to provide barrier-free routing for wheelchair users, people with other kinds of motor impairments, and potentially elderly people. So basically, it's a device which you can use in a urban environment to get a routing which will take into account the steps, the ramps, to make sure that if it helps you to go from A to B, it provides you with an itinerary which is respecting the constraints you experience in mobility. and that prototype should result in a commercial product by the end of this year. And I will try to be quick in the last projects I mentioned. One is InnoServe, it's FP7 project. It focuses on research in the field of innovative services. So it's a bit having a picture of the most innovative services today with regards to service provision to people with disabilities, and to understand what are the reasons why these services work well, and to enable other services to inspire themselves from this model. And yeah, that's it basically. And the last one I wanted to mention is PESIS in the field of social dialogue. So there's a big gap at European level in social dialogue, because the not-for-profit service providers in the social sector are not really represented. Although there are mechanisms of social dialogue at European level, the social sector is not very well represented. So the idea of the project is to understand how social dialogue in our sector is organized in different countries of Europe, and to promote, to make sure that we can also get involved in social dialogue at European level. So on the basis of what exists, get involved in the social dialogue at European level. That's it about some projects, just to give you an idea of the different areas we are covering. Thank you very much for having listened to me. I hope it was clear and understandable, and feel free to ask questions if needed. I put some leaflets of different projects I mentioned as downloadable documents, which Sabrina was mentioning before. So feel free to, if you are interested in our projects, to come back to me with more specific questions if needed. Thank you.
Thank you, Hervé. It was really clear and understandable, don't worry. Sorry for pushing you for the time. So now I would like to see if there is any question for Hervé. In the meanwhile, if Michel Huber wants to write down the question he had for Tula, he's welcome to do it. Okay, then the question to Tula was about Nomo. Do you use a standardized instrument to assess the wheelchair use and the contentment? I will allow you to speak, all participants to speak, so that if you have any question, please raise your hand before.
Can I answer?
Yes, of course, Tula.
Yeah. Yes, we are. For example, Quest, and then there is Quattro, that is quite similar to Quest, but the research group is validating this Quattro. And then there are quality of life standardized question about quality of life. I can't remember the name of it, but if you are interested, I can write it down to you. But yes, we are using standardized testing evaluation.
Thank you, Tula. Is there any question for Hervé about EASPD, his organization?
I see that there's one question from Jeanne.
Jeanne. Yeah. So, yeah,
So
you're free to answer. Sorry, I didn't see it.
No problem. Just yes, there is a list of our members which is to be found on our website. And if you send me an email, I can also send you the full list of our members so that you can get in touch with services which are our members in the Netherlands.
Thank you. Well, in the meanwhile, I remind you that the next webinar will be in June. Exactly, will be on the 13th of June, and the speakers will be Zwid University. So I suppose there will be Jan Eiker speaking, and there will be Theapat from Spain. So I don't know if at the time there will be Lucia Perez or there will be Reyes Noya, but we will check later. The last thing I want to remind you that there will be this very important workshop in Copenhagen in 10 days time, so it's getting nearer. The event is getting nearer. It will be an international workshop organized by the AAAT, and it will be about national service delivery systems. It will be held in Copenhagen on the 21st, 22nd of May, and so you're all invited to participate. So if you can, you are very welcome. Well, in the meanwhile, I see that there is no other question. I think it was quite the presentation of Hervé was quite comprehensive, and also there are brochures that can give some material to delve into EASPD projects. So I would close the meeting, thanking everybody, especially the two presenters. So thank you, Hervé and Tula. And of course to all of you who participated.
Thank you, Sabrina, for hosting that meeting and administrating it.
Okay, thank you. I can see that there is Warren raising his hand. I don't know. Do you want to say something, to ask a question, or
He's uploading.
Was it a mistake? Warren. Also Renzo has raised his hand. Renzo? Warren? Okay, so for Warren it was a mistake. Renzo, do you want to say something? So there were two mistakes at the same time. Well, no more question, no more people want to intervene. So I thank you once again, and hear from you soon. Thank you.
Thank you. Bye-bye.